Okay, so we're going to go over the Philips monitor and how to set up the 12 lead, program it in, turn on the pacemaker defibrillator, where the end-tidal CO2 is, and where the battery is, and how to check the level. Starting with battery, right here we have two battery options, A and B. We typically just carry the one battery, battery A. The B has an X in it. On the back over here is where the actual battery is. It's very simple to take out. There's a clamp on there, pops right out, real easy. I'm not going to take it out, obviously, for it. We'll turn off the monitor here. Right here we have our leads. There's a red side for a 12 lead and a blue side. The actual patient leads are kept in this red container on the side, and they snap in very straightforward. They only go one way. They snap right in. And yeah, so then we just connect it to our patient like we normally would. This is our SpO2, blood pressure cuff. We keep the pacer pads in this red pouch, EKG dots, and our glucometer is also in that section. Looking at the front, this is where we print our lead strips. Just pushing that button. Over here, you would start your blood pressure in the that button there. To run a 12 lead, we will go to menu first. We'll put in our patient's name. We'll go A, B, C, and then we scroll back up, and there's a button that says Done. Done. We'll also put our age of our patient and the sex of the patient. Okay, so then we'll hit 12 lead. And we'll hit Start Acquire. The 12 lead automatically brings that up once you hook in your leads. Hit Start Acquire. It says acquiring 12 lead. Don't touch the patient while it's saying it's acquiring. Once it says analyzing, the patient can move around. It's not going to say anything. It's going to tell us that everything's missing. We're going to hit Exit 12 lead from there. Over here, we can set the blood pressure frequency. So we will go to, sorry, let me show you, speak that out, I apologize. You will hit Menu, you'll go to Measurements and Alarms, hit Select, and then you'll scroll to blood pressure, and you'll hit Schedule, and we'll set it for every 10 minutes, whatnot. Okay, on the side here, this right here is where the end-tidal CO2 connects right in there. You do slide this down and you just twist it in there. For the setting up the pacer, you will turn this to pacer. It's going to bring up some options down here. We're going to change our output. These are the arrows. You push it up and down, and then the rate, and then you would hit Start Pacing. It's on a demand mode automatically. If you do need, and that's typically what you want to do, but if you did, there are options to change it back to the type of pacer mode, and you would just hit Menu button and it does that. Okay, so if you were to need to defibrillate your patient, you would change it to 150, which is the typical adult dose. You will hit Charge, and hypothetically you would hit Shock. Okay? So now we're going to do an OBS check. So to run an OBS check, you hit Menu. You'll scroll down. These buttons move it up and down. Other. And you hit Operational Check. And Run OBS check. It's going to ask, are you leaving patient care mode? Acknowledge. Yes. It's going to go black for a minute. Everything's okay. It has to do that. And then it's going to start running the test. Now it's going to ask you to turn to 150 joules. And you're going to verify that there's a test load attached, which I know there is. You're going to hit Charge. You're going to hit Shock.
Shock delivered.
And it's going to ask you if you heard the shock. You'll hit Select. And probably another 45, 50 seconds, it will print out this type of summary of everything and tell us if it passed, and it did. It's kind of a long thing, so I'm not going to print it out again. Yeah, so that's just a quick overview of the Philips monitor.